We're going to start, first of all, with a letter written last week to the Prime Minister with the support of nearly 500 health professionals and scientists. The letter disagrees with the current lockdown and, in particular, says that testing is exaggerating the risk of COVID.
Well, Ros Jones from parent support group UsForThem is one of the campaigners behind the letters, and we can talk to her now. And it's lovely to have you here. Thank you very much indeed for joining us,
Hi,
Ros. So, what is the aim of UsForThem? What is it that you're doing?
well, the main aim is to get children back into school normally. It was started back in May when kids had been taken out of school in March, very understandably, because we didn't know what COVID was going to be like. But then when the numbers started coming down, schools didn't seem to be reopening. And that's when the two parents who set this up began. And even now, although schools are open, they're open in such an abnormal way. You know, primary school children with parents being told they have to wear masks. So children are coming out to a sea of face masks. What's that doing to their mental health? And I can't find any evidence that anybody has done proper risk assessments to look at the impact on children's mental health.
Well, you believe that the government's approach is actually doing more harm than good. In what way?
I do. Well, I think if you look at life years lost potentially from different conditions. For example, COVID itself, the average age of death is slightly higher than the average age of death from all causes. So these are people who are near the end, not all obviously, and every death is tragic, but most of them are people who are going to be near the end of their life. But the increase in deaths that we're seeing for non-COVID causes are things like heart attack deaths in the home we're seeing more of. They will be people perhaps in their 60s rather than their 80s. Then you'll see cancer deaths. These are going to be coming over the next few years. When the winter pressures, every year we cancel surgery, but once the flu pressures go, we then reopen up and we start catching up with the backlog. And for some reason this spring, the normal reopening just got stuck and didn't happen. And then you look at suicides, they've doubled. Now, there'll be perhaps people in their 40s with years and years ahead, with young children at home. And all of this, the balance in the daily statistics, the way anxiety is rising, because every day on our televisions, on the news, I think there was 1 week in August where suddenly it wasn't the top of the list. But it's the daily death toll rising. But where are the deaths? We don't tell people every day how many people died of cancer. And I'm not suggesting we should for a moment. I think we normally, death is the last taboo, and we try and bury our heads in the sand and pretend that none of us are going to die. We're all going to die sometime, but we don't need it in our faces all the time for only one disease. I just can't see how it helps.
You say that that it's used the words disproportionate, causing more harm than good, which you've explained then. You say that the official data is exaggerating. Yet you watch these briefings and you do see this really rather sharp graph that looks much bigger than it was the first time round. So you can understand that we get a bit scared.
I do understand that. I think one of the problems, though, is that the way the data is presented, often they miss out. We don't know the case numbers from the beginning because we were only measuring people who were sick in hospital. So that gives you a false feeling that what's going on now in terms of cases is enormous and far, far more than it was originally. And we don't know that. And the other thing that we see is the deaths. If you look at the rate of rise of deaths, it's very, very much slower than the first peak. This is just winter rises. You look at flu deaths and pneumonia deaths and COVID, and you put them together as respiratory deaths, and we're running at 5-year rolling averages. Now, that's not what comes across. And I'm sure I shouldn't probably, but, you know, that's just an example. That's Liverpool already coming right down again. Now, we're not seeing that, are we? We're not seeing that the graphs, just when we're rolling out more and more testing, almost screening testing, and we're using a test. The other trouble is we know that the PCR test used has a very high false positive rate. And nowhere, despite numerous scientists asking for it, has the government provided proper quality assurance that shows, you know, in the lab, normally all your tests have to be replicated in other labs. You know what you mean when you say a test is positive. We don't know whether it's like saying you're anemic, but not saying whether your hemoglobin's, you know, 11.5, in which case it's fine, or whether it's 3 and you need a blood transfusion. It's just a yes, no. It doesn't tell you whether actually this is dead virus from 6 weeks ago and actually it's not infectious. And then you're putting not only that person into isolation, but also all their colleagues. So if you start rolling out routine screening programs for which this test was never devised, then you're going to find increased cases. Of course you are.
So
then you're going to just close the schools.
What does the government do then? What should the government be doing?
I think they should be really concentrating on protecting the elderly and the vulnerable. And I don't think we've done that very well. We've let the deaths in care homes be enormous. We've got bank staff going from place to place. I think what this has shown is a long-standing problem with the care service that we have. It's a Cinderella profession. We rely on staff from abroad, and then they couldn't come because of restrictions in travel. You know, there was an outbreak on the Isle of Skye just because that care home was part of a company, and they brought staff in from Kent, and they brought COVID, and suddenly there were deaths on an island which had not had any cases. It's the detail. We're trying to do too much instead of concentrating on what actually matters. And these are the people who are really going to be in trouble with this disease. Also, I know one thing about schools. We really want schools open. But the suggestion is, but what about children who then live with their grandparents? And there was a really interesting paper came out this week, and there's been a similar one, smaller, in Scotland. But this was a large paper from England, from NHS data, showing that actually, if you live in a household with children, you are less likely to die of COVID. So grandparents, people in multi-generational houses, are actually not at so much risk. I just think back to my own career as a paediatrician. The first weekend I started my first job in paediatrics. I worked Thursday, Friday, and I went off sick on Saturday. I thought, this is so embarrassing. And I got 2 more illnesses, you know, German measles and whooping cough, because I was too old to have had vaccinations for them. And since then, I had 30 years of going into work every day, seeing kids with snotty noses, diarrhoea, you name it. I never had a day's sickness.
Thank you.
And that's because I was contacting, and I'm really worried that I'm not allowed to see my grandchildren, because to me, seeing my grandchildren and hugging them is part of them protecting my immune system.
And a lot of grandparents feel like that as well, up and down the country. Ros, thank you very much. Thank you for joining us this morning. The government have sent us a right of reply here. They said it is completely wrong to suggest that the government is exaggerating the data. The national restrictions have been introduced to save lives and protect the NHS. We recognise the impact is unprecedented period has on people's mental health, and it is vital people follow the rules over the coming weeks to bring the transmission rates back down.